Hello, NAFI members and flight instructors. This is John Niehaus, Director of Program Development for the National Association of Flight Instructors. I'd like to welcome you to another episode of the NAFI More Right Rudder podcast for flight instructors on the go. And I have here with me again, welcome back, Dr. Victor Vogel, CFII medical oncologist and NAFI board member. And I will admit, if you're watching this, yes, we're wearing the same clothes from the last time he was here. We got to talking and we had so much more. So we thought we'd just jump right into sort of a continuation of what we talked about the last time he was here. And we were thinking that maybe it'd be a good idea to talk about a few of the things that are on the list, the medications list that we referenced previously. And Dr. Victor Vogel, I'm going to let you take it from here. What do you want to talk about?
Well, I'm looking at this list that's published by FAA on the FAA.gov site. If you go to the medical subcategory on that site, there's a PDF file called "What Over-the-Counter Medications Can I Take and Still Be Safe to Fly?" It's pretty straightforward. And then there is a list that is grouped by types of drugs: antihistamines, decongestants, cough medicines. And there are two columns. There's a column that says the medication or active ingredient is generally safe to fly. And under that, it says go. And then there's one that's a column next to it that says avoid these medications or ingredients. And that column is subtitled no go. So it's pretty simple. So let's go through some of these things and just point out to people, pilots, that this is a relatively straightforward list, and it's easily accessible on the internet, and it can answer a question for you pretty quickly if you're taking an over-the-counter medication and want to know whether it's safe.
Yeah, I think that's a great plan. I do have one question before you start. And we referenced this a little bit on the last one, which was, talking about certain medications that you just absolutely cannot take irregardless. But is there something that you could accidentally take over the counter that would, and I say accidentally more from a knowledge standpoint, but is there something that you could take that all of a sudden, because you took it for a specific reason, disqualifies you from flying? Like, could you take something for an ache or pain or a sickness that you can buy from a pharmacist and then all of a sudden find out that you just disqualified your medical? Is that a thing?
Yeah, I suppose it could be. For example, most of the ache and pain drugs are safe. Things like Tylenol and Motrin and Aleve and those things. But if it's a pain medicine that in the name of the drug includes the letters PM, meaning, oh, take this when you go to bed, it'll help your pain and it'll help you sleep. Virtually all of those medicines that have PM in their name or title are not acceptable, because most of those PM medications contain that medication known as Benadryl or diphenhydramine, and it's sedating. And so the pain medicines that have PM in their title are generally not to be used. And that might be a little confusing, because we'll tell a pilot, well, sure, you can take Tylenol or you can take Advil. That's okay. And then, they have this bottle at home, or they go to the pharmacy and they pick up this bottle and it's Motrin PM or Advil PM. And then, whoa, wow, I can take it during the day. Oh, but I can't take it at night if it says PM, because it might be sedating in the morning. So those are the kinds of things you could not be aware of potentially.
But there's nothing that I could get from a drugstore that, I would take and then effectively have to put my medical in the shredder. Like it would just be waiting the duration till it wears off.
Right. And most of those things, I like that expression, put my medical in the shredder. Most of those things would be, immediately disqualifying our prescription medicines.
Good. Okay. So it's the odds of somebody taking it to help to help a legitimate medical issue, by accident, and then finding out that they can no longer fly. That's not really going to happen.
Yeah, that's very, very unlikely.
Okay, cool. Well, let's get to this list.
Yeah, so we could illustrate that by looking at some of these things. So, we said, well, you can't take Benadryl or medications that contain Benadryl, but we might be surprised to learn that antihistamines, and depending on what part of the country you live in, several seasons of the year can be pretty challenging in terms of allergies, right?
Mm-hmm.
So we all want to take our allergy medicine. So, for example, medicines like Allegra and Claritin, perfectly okay to take. They're antihistamines that, unlike Benadryl, which you can't take, they're okay. So Allegra and Claritin are on the okay to fly list. But on the other side of that, there are some antihistamines like Zyrtec and chlorotrimazole and Zyzal that aren't okay. And it would be hard to know that just intuitively. I mean, how would a person know? And even a physician, I wasn't sure which bin these things sorted into until you look at the list. And that's why the list is useful, because it sorts out those questions for you. And you may say, well, you mean I can't take Zyrtec, but I can take Allegra? That's the kind of information that's available on this list that's very, very helpful.
Yeah.
And it also saves the burden of having to call your primary care physician or the AME and ask them, because here it is on the list.
Yeah, it's easy to think that they're all the same, just a different brand. So it's easy to be misled by the idea that, well, I can't use this, so I can't use any of these, right?
Yeah, so I can't use any, whereas some of them are okay and some of them are not okay. But it's not intuitive as to which ones might be okay.
Yeah.
And here's maybe another surprise. Some people have, nasal congestion. And you say, well, so many of those patients are treated with nasal steroids. They're inhaled through the nose, nasal steroids. And you say, well, is that okay? Yeah, that's okay. But the thing you got to be aware of there is, well, if you have nasal congestion, are you also going to have the ear block and have problems, as you climb and change pressures or descend and change pressures? It can work either way. Any pressure change could cause problems if you have middle ear or sinus problems. And that can sometimes be an accompaniment of having nasal congestion. So you have to ask yourself some questions. Well, am I having problems with my ears? Am I having problems with my sinuses? But if it's just nasal congestion and you're using inhaled nasal steroids, those are on the okay to fly list. So that's important. And then nasal decongestants, you may think the same thing. There are things that you can spray in your nose to relieve congestion, drugs like Aspirin and Sudafed, and there's some others. Those are okay. Now, it is true that those drugs can, in some patients, increase their heart rate. And so you want to be careful if you're using those drugs that are potentially stimulants, that, if you're using Sudafed, you want to be careful that you're not cranking up your heart rate and perhaps causing problems there. But and it's best, here's another little suggestion, that you don't take a new medicine, a medicine you've never taken before, 30 minutes before you fly, and then you hop in the airplane. Even if it's on the safe list, you probably should take those medications on the ground days before, see if you feel all right, make sure you don't have any untoward side effects. Not a good idea to take a brand new drug minutes before you start a flight. That's to be avoided.
Well, and that's interesting because, I think anytime anybody says Sudafed, especially, pilots tend to sort of perk up and go, wait, what? Because we all sort of have this knee-jerk reaction that there's something wrong with Sudafed, you're not supposed to take it. But you just said that might be okay based on the situation.
Yeah.
That's interesting.
It's on the okay to fly list.
Wow.
And again, there are surprises on this list, and that's why I find the list very helpful.
Yeah.
Because as I said in one of our earlier conversations, I thought surely a drug like melatonin that people take to make them go to sleep would be on the don't use list, but it's on the perfectly safe list. So the lists are useful for in many regards. Let's move on to something else. So cough medicines, so we all have occasional time when we, got to get that bottle of cough syrup over the counter. And the main ingredient of cough syrup is a drug called guaifenesin. And that's perfectly safe. That's okay to take. And it comes either in pill forms or liquid forms, and it's okay. But what you have to be careful of is some of those cough medicines, again, are labeled PM, nighttime use. Pretty hard to fall asleep if you're coughing and hacking. Well, some of those nighttime cold remedies also contain our old friend Benadryl, or and some of them contain something called dextromethorphan. Dextromethorphan is a derivative of narcotics that's a very effective cough suppressant. So if your cough medicine just has plain old guaifenesin, like a bottle of Robitussin, that's fine. But if your cough medicine is labeled PM, or it has dextromethorphan in it, dextromethorphan, because it's a derivative of a narcotic, can be sedating. So this list helps to sort out those kinds of questions.
I'm trying to think of the main cough medicine brand. I know we actually have some upstairs.
Well, we got Robitussin and Dayquil, NyQuil, those kinds of things.
So is Dayquil on the approved list?
Dayquil is okay, but NyQuil is not okay.
Right.
Oh, actually, Dayquil is not okay. Dayquil is not okay because it contains dextromethorphan.
Interesting.
Yeah.
Okay.
But if you take plain old Robitussin, not Robitussin PM, but plain old Robitussin, which is just plain old guaifenesin, that's okay. So again, this is why you have to look at this list.
As a medical professional, I have to ask you, is it required for cough medicine to taste awful?
Well, the ingredients taste awful, and what the manufacturers try to do is put something in there that makes it tolerable and palatable. So, they make it cherry flavored or they make it mint flavored, but it doesn't always hide the nasty tasting bitter substances that are in there.
Yeah. Every time I ever think about even having any cough medicine, it's, I have to be dying because it's just so bad.
Some of them are pretty nasty. It's true. Let's see what else. We talked about the pain relievers that contain PM and how that's not a good idea. Some medicines, like some headache preparation, contain caffeine. Now, of course, we all, if we had to eliminate caffeine, probably 90% of the pilot community couldn't fly anymore. So caffeine is fine. There's no problem. And if the medication contains caffeine, that's fine. No restrictions there. What else is good? Many of us suffer from a condition we call, well, the lay public calls it heartburn. We medical professionals call it GERD, gastroesophageal reflux disease, So plain old heartburn. Well, there's all kinds of over-the-counter preparations to deal with heartburn or GERD. And virtually all of the over-the-counter ones, whether it's Nexium or Prevacid or Prilosec or Proton, they're all okay to take. And again, you might say, well, might there be something there that might be a problem? And the list has them on. And there are other drugs that like Tagamet and Pepcid and Zantac, those are all okay. And certainly things like Tums and Malox and things that we just grab 2 or 3 and chew on them and we have a little heartburn, those are all okay. So, many of these things we take every day and we don't even think about it. But if the question comes up, well, these things are on the list. And in these 2 columns of yes and no medications are very, very useful.
Well, as we transition from seasons, at least up here in Michigan where I am, colds become a thing. What about cold medicine, like Tylenol cold? Is that what's in that?
Yeah, the one that's a no is Tylenol PM. If it says PM, it's got Benadryl in it, diphenhydramine in it, and that's a no. But it probably is okay. But you have to read the label and look to see what the ingredients are. You might be. This is kind of an interesting one. Drugs that prevent nausea and diarrhea are mostly okay, but I would think it's not a great idea to self-medicate for nausea or diarrhea and then plan on going to fly. I think if you have those kinds of symptoms, it would be best to stay put until those symptoms resolve.
For a multitude of reasons.
For a multitude of reasons, yes. But it is curious that those drugs, with the exception of the drug Imodium that we often use for diarrhea in our cancer patients, that drug is on the no-fly list. But
is it really? What makes
yeah.
Imodium not a no-no?
It's probably because it is it has narcotic-like principles.
Really?
Narcotics are constipating, and so that's probably why it's on the list.
That's a surprise. I would have never guessed that Imodium would be an issue.
Yeah, well, that's what I'm saying. It's very hard to intuit these things, and that's why when the FAA decided 2 years ago to finally publish this list, it's extremely helpful.
Yeah.
And then, with prescription medications, basically the AMEs have lists for the prescription medications, and you can tell them what medicine you're taking, and they can tell you whether that's okay. For example, the drugs that are used for erectile dysfunction are essentially all no-nos. Yeah. So for some of our older pilots, and maybe not so older pilots, they need to be aware that those drugs, like Viagra and Cialis, are on the no-fly list.
Interesting. And what makes them? What is the inhibiting issue there?
Well, I think it's largely theoretical, and the rare instance of disturbed consciousness or attentiveness, and that's complicated by the fact that much of that data was collected in older patients for whom those symptoms may be the result not of the medication, but just of other conditions or life circumstances. Yeah. But anyway, if you have a prescription medicine that's new and you're not certain, just check with the AME.
Now, you mentioned most of your aches and pains medicine are okay. I'm sure there are also many older pilots that tend to, take the the physician's recommendation of, maybe aspirin a day or something like that. I'm assuming that's okay, right?
That's okay. Yeah. But depending on the situation, and it's a pilot to pilot thing, sometimes there are patients who take so-called anticoagulants. The lay public refers to them as blood thinners. And some of those blood thinners make one ineligible to fly, and some, depending on the situation, are okay. And again, that's an individual thing where you got to check with your AME about what's acceptable.
Sure. There's also, and you mentioned CBD in the last podcast, but you go to the grocery store and there's 2 aisles of what they consider like the natural products and whatever. Are there ones sort of in that aisle, any of those like vitamin supplements or anything that people should be aware of, that maybe they should at least, maybe not mentioned on the list, but they should at least sort of consult a physician?
Yeah. So most of those things that, they fall on a list that the FDA, that is the Food and Drug Administration, refers to as GRAS substances, GRAS, generally recognized as safe. So there's no information, no data to indicate that these particular so-called natural products are a problem. But I cynically like to say sometimes, poison ivy is a natural product. And so just because it's, quote, natural doesn't necessarily mean that it's safe.
Yeah.
And so again, my recommendation is, sure, those things in the nutrient store, in the nutrient aisle at the grocery store or the pharmacy that you can just buy without a prescription, those are okay. But again, if you're planning to fly while taking one of those, please take it days or a couple weeks before to make sure that in you, particularly in this person, in this pilot, that it doesn't have any untoward or adverse effects. Again, you wouldn't want to take one of those things the morning you're going to fly, having never taken it before, to see what happens. I mean, for example, some of those over-the-counter remedies can cause symptoms like headache, nausea, diarrhea, all kinds of things that you wouldn't want to experience as a pilot. And those are very variable. Many patients can take those substances, those compounds, and not get those symptoms. But wow, what if you did, and it happened, 30 minutes after you departed on your flight? So you don't want to take those things for the first time ever on a day of flying. You want to take them ahead of time and make sure that they agree with you.
Yeah, here's another one that's sort of out of left field, and you may or may not have an answer to this, but what about like diet drugs? Those the kind that you can get from the grocery store, and maybe somebody's trying to lose weight or something.
Yeah, and again, you have to be very, very careful with those, because many of them are stimulants, and they can increase heart rate and have other untoward effects. And again, you have to read the labels very, very carefully. And again, not take those things without some investigational period, using them for a period of time of days or weeks before you fly, because some of them do have rather significant side effects.
Any other ones you want to talk about? Any other surprises on the list?
No, I think those are most of the ones we talked about. And topical products, things you would put on the skin for a rash or a sunburn. So most of those are okay. It's just the things that we ingest. So I just encourage everyone to become familiar with that list. And if you have a question, and you can also ask the pharmacist. A pharmacist will be able to tell you, a good pharmacist in a retail pharmacy store will be able to tell you whether something has expected untoward or adverse side effects, whatever it might be, nausea, diarrhea, sedation. They can help you with that as well.
So the general rule here that I'm gathering is, before you take something, either consult the list, consult your AME, consult your physician, combination of all of those things. But certainly if you want to do some preliminary research, take a look at this list. That's is it on FAA.gov? Is that where it is?
Yes, it is.
Excellent. Excellent. So, just for those listening, we do not provide medical advice. No. And while Dr. Victor Vogel does in his professional standpoint, this is not in that realm. So don't use anything that you heard on this particular podcast as medical advice. Make sure you consult your own physician and AME. But I do hope that it provides you with sort of that next step of understanding, to know where to find these things and know what questions to ask, because some of these things, like Dr. Vogel said, are surprising. The biggest one for me is Imodium. How am I going to go and get my sort of different types of ethnic food and still fly? What am I going to do?
You're gonna have to time it carefully, John. Time the consumption very carefully.
There you go. Or if not, then I got to wait 5 times the duration, like we talked about last time. So this is all good information. Victor, thank you so much for coming back. Thanks for sharing this information with our listeners and with NAFI members, and we really appreciate the expertise.
Glad to help.
And as always, if you haven't subscribed, please do. If you're not a member, sign up at nafinet.org. And, again, we're collecting questions for Dr. Vogel. So if you've got something that you'd like to ask him, by all means, email us at nafi@nafinet.org. Thanks for joining us, and have a good rest of your day.